Good morning, everyone. Just briefly wanted to say good morning and welcome back to day two. We have a robust agenda this morning. Appreciate all of you and your strong interest in supporting families in all sectors, and just want to just acknowledge that we are continuing on this journey. We're here to provide the support that you need. Uh, I know yesterday was a contextual setting overview, and you got some inspiration by listening to Alice Morales. So, hope you carry that spirit on today with the agenda that we have. And I won't hold you up without further ado, and I'll just let this day get started. And I hope that you're energized and motivated to continue forward with doing this work. So, keeping in mind the purpose that we're doing this all for the good of families, including our probation youth. Um, and I'm very excited that it looks like for this second day that we have a really robust cross sector of representation at every level. So I am looking forward to hearing about the end of this day and how beneficial it has been for all of you.
Good morning, everyone. My name is Franny Desai. I work for the Office of Child Abuse Prevention at the California Department of Social Services. And here is, along with me, is our Bureau Chief, Kelly Winston. And I just wanted to welcome everyone this morning. Many of us here have been working on prevention planning teams with the original 23 teams that participated in the summit in 2019 and have really been champions of prevention planning work. And those that have come on board after the summit with the support of our strategies TA. So thank you, Lydia and Michael Williams and Sarah LaCroix for all your support. And I just want to acknowledge all the hard work of all our prevention planning teams over the last 2.5 years who have done wonderful work as we continue our work towards making a continuum of care for all of prevention services.
Thank you, Franny. So I did just want to acknowledge that we also have some folks here, according to the poll, who are a little bit new to prevention planning teams. We want to acknowledge that you're here and excited to do this work. And we want you to come along with us. So we're going to do a little bit of background work to talk about where we've been. And the purpose of this is really to explain how all of the pieces of the different elements of the Family First Prevention Program here in California work together to create the way in which you all will be doing prevention planning as we move forward. So this slide you saw yesterday, if you were with us, Cheryl talked a little bit about how all these pieces work together, but we're going to dive in just a little bit deeper to make sure everybody is up to speed. Some of this may be a little bit duplicative for folks. And then what we're really trying to do is focus on where we at now and how does each of these pieces work together so that you're all set up to develop your own local comprehensive prevention programs. So we'll start with the Family First Prevention Service Act. So most of you are really familiar with FFPSA, but just wanted to set the context by talking a little bit about this very complex law. Has multiple pieces to it, but of course for today we're really focused on part one. And you know, this really is a great federal law. It allows us to draw down Title 40 funding and reimbursement for these mental health substance abuse treatment programs and in-home parenting skills. This program is really intended for candidates for prevention services or those children who are at imminent risk of entering foster care, and then also for their family members who can participate in those services. The program goals under the federal law are really to decrease foster care placements, increase that ability for kinship support so that when possible, youth who are potentially entering our system are able to be with their family members and folks that they know, and really decrease that trauma that they may experience when entering foster care. And then really the crux of prevention is to increase opportunities to ensure family well-being at the earliest point possible. One of the aspects we always like to point out for the federal prevention program is that concept of payer of last resort. where typically we see Medi-Cal in that payer of last resort bucket. But for this one, it's a little bit different where Title 4E becomes the payer of last resort. So some of the complexity we're going to talk about over the next couple of days is really thinking about how that process works. And then just highlighting some of the additional features of the federal law, our requirements for continuous quality improvement and model fidelity of the services that we put in place, the requirements for a professionally trained workforce, and then additional requirements for data reporting, which includes per child expenditures, which is something that we've not had to do in the past. So the next piece in the puzzle for our prevention services program in California is the 5-year prevention plan that California is in the process of working through. So many of you know that last August, we submitted our first draft of our prevention plan to ACF for approval. And they went through and gave us a lot of really good feedback where they asked for some additional details and clarification for some of the things that we had already included in the plan. But then some areas where we really did some restructuring and building out with quite a lot more detail. Those are the items in the yellow that you see there, where we really built out our continuous quality improvement approach. We added a lot more information and detail about how those pieces will work together. And then in addition, we talked a lot about the local agency opt-in process, as well as how we were going to structure our training to ensure that we have that workforce training and development that is required for the federal law. I always like to highlight that this prevention plan is really about how we're going to include the federal law in California's approach to prevention. This is really how we are going to ensure that we can engage activities that will draw down that Title 4E federal match to support ongoing prevention work that California wants to put into place. The plan also includes our vision. You can see the original kind of items up there in white, but it includes our vision for equity and inclusion, for reducing disproportionality and disparities in the system, and really our effort to try and ensure that we utilize the expertise in our local communities to ensure that we get the right services in place. So it's a balance of that federal need versus how the state is going to implement this federal law. And really the purpose of the plan is to ensure that we're able to opt into the program and expand upon what we see that federal law being as somewhat limited to a more comprehensive approach in California. So this next slide really covers how, and again, many of you have probably seen this before. This slide hasn't changed a whole lot since the first time most of you have seen it. Really identifies how we have identified the Family First Prevention Services Federal Act into state law, but then we also go beyond these elements in FFPSA to describe how we want to go upstream a bit more than what the feds had imagined, and really cover a comprehensive approach to prevention. So through this law, we were able to expand to comprehensive prevention services, which include primary and secondary services, as well as the tertiary services that FFPSA provides for, with those evidence-based programs that are mental health, substance use treatment, and in-home parenting skills. So this really allows us to include a lot of different types of services. And we'll talk about the state block grant in just a minute, which helps to fund those services. But in addition to those basic requirements in the federal law, we have also expanded to ensure that the program in California is consistent with the vision that we describe in our state prevention plan, and that we really have this cross-sector collaboration to ensure that the programs we select in California meet the needs of those that we believe should be prioritized, and really to punch up that concept of the importance of equity and inclusion and reducing disproportionality in our system. So the next piece of the puzzle here is All County Letter 2223. This is a letter that describes our state block grant and our approach to comprehensive prevention planning. So many of you are aware that the state has allocated $199 million to be expended over 3 years. And the letter talks a lot about what are the different activities that counties can claim under the Title 4E portions of this program, and then also what can be claimed under the FFPS state block grant. So that block grant really allows us to do the work that goes beyond the federal law. And so this letter is the document that helps explain those requirements. In addition, it lays out all of the elements that are to be included in local comprehensive prevention plans and the due dates for those plans. So many counties have already opted in by providing a letter of intent so that they could obtain early access to the state block grant funds and start really thinking about how they're going to plan and come together to develop the elements that they want to include at the local level. By April of these last few months, we received letters of intent from 49 counties across the state, which is very exciting. And so that enables them to use that funding to develop their comprehensive prevention plan. Those prevention plans are due by January 31st of 2023. So right now is when the really intensive work is truly beginning. And we're excited to give you a lot of things to think about today that will help you do a lot of that work at the local level. A couple of things we like to identify is just really a couple of concepts around maintenance of effort. So maintenance of effort is a federal requirement where we need to ensure that we maintain previous levels of prevention spending. And really all that means is that the federal government looks back to 2016, where we established how much money we were spending on the prevention programs that were included in our prevention plan that we submitted last August, and our commitment to maintain those previous levels of spending. So we're in the process of figuring out what the burden will be for each county who's opting into the program. We won't know the total dollar amount for that until we get every single comprehensive prevention plan submitted. So more to come on that. And then the state block grant letter really does include some good information around how counties can obtain technical assistance. Some of that is for work in developing capacity at the local level for really being, having a system that's ready for change and to do that upstream prevention work that we've not been able to do in the past. And then also to really think through how to get ready to implement those services. So really good information in there about things to think about for capacity building and readiness that Franny will be talking about a little bit more. So I wanted to just kind of highlight a few of the examples where you can kind of see the differences between what you can use some of the Title 4E funding services for. So again, this is really about what's contained in our 5-year prevention plan. So these are really those tertiary prevention services. What's in the federal plan is all of the well-supported services that were in the federal clearinghouse at the time that we first submitted our plan. And in order for counties to be able to draw down Title 4E funding, the services have to be in the California Prevention Plan. I always like to call out too that our state law says that we'll be reviewing that plan once it's approved on an annual basis. So we have the flexibility to add additional plans or services over time and make any other changes in the plan that we provide to the federal government as we learn more about what we need in California and where we'd like to grow. The population served by the Title 4E funded services, again, our candidates for foster care is determined by a Title 4E agency, and then those services can also benefit the members of their family. The federal law also calls out expectant or parenting youth, and we never want to forget about those youth. They're the only part of the prevention services program that can actually be in foster care and benefit from those services. And then additional activities that can be claimed under 4E are related administrative and training costs. You know, these are costs that if you're planning your prevention services program and helping to develop your Title 4E eligible services, those are costs that can be claimed with the 4E dollar. And you can see in the right-hand column of this section, this slide, the services that we already have included in the state's prevention plan. And so this slide, again, has examples of what can be supported by the state block grant. You can see that this is quite a bit more expansive. So this includes primary, secondary, and tertiary services. This is really any primary or secondary prevention services that can meet your local needs. We really wanted to place the emphasis on services that, that are culturally responsive to your community's needs. That is something that we have really tried to identify as part of our vision for prevention in California. But we also want to highlight that you can also use these funds to support EVPs that were not included in the state's prevention plan, if that's something that best benefits your local needs. And really the population served here is dependent upon what your needs are at the local level. So lots of flexibility in who you can serve as compared to what is eligible under Title 4E. And then again, additional activities that you can claim under this block grant are other planning activities that go beyond the Title 4E program. And then, you know, how you might think about building sustainable prevention infrastructure using other ongoing prevention funding sources that you'll hear a bit more about tomorrow. And then, you know, again, the services on the right-hand side of this slide really talk about the flexibility and what you can do using state block grant dollars. Okay, and then I just use this slide to bookend. It really is pulling this all together, how federal law, the prevention plan, the state block grant, and the state law support this different kind of prevention services program in California. And this is what we had to put in place in order for counties to be able to get to the point to start building their comprehensive prevention plans. I'm going to hand it over to Franny at this point because she's going to go in a lot more detail about what that will look like and what you can expect to see today that will help you build those plans.
Thanks so much, Kelly. I appreciate that. And so again, to the next slide, thank you. So again, good morning, everyone. So this slide really demonstrates about our Family First Prevention Services program. As you know, it's part of AB 153, and it's really our state block grant that allows us to fund that comprehensive prevention planning. And just as a reminder, our state block grant really is an opportunity for planning and direct services. You can use its flexible funding to be used in both instances. The comprehensive plan should incorporate both primary, secondary prevention strategies, and then of course tertiary prevention strategies as well. But our tertiary prevention strategies are really focused on that FFPSA Part 1. So if you think of it, it's the entire continuum, and FFPSA Part 1 is a portion of that larger system that we're looking for. And the state block grant was an opportunity, as Kelly has kind of mentioned before, is to expand on FFPSA Part 1, because the FFPSA Part 1 does have its constraints in the target population that it can serve. Whereas the Family First Prevention Services program is much more expansive. And just as a reminder, it's really been established to Welfare and Institutions Code 16588. And we hope that this whole system will support the ability of parents and families to provide safe, stable, and nurturing environments for their children. This slide really depicts our community pathway. And some of you folks on the line may have already seen this community pathway as in the past, if you've read our draft plan to ACF. But as a part of the comprehensive prevention plan, a planning team may choose, this is optional, to implement a community pathway as a way to reach families before system involvement. That's what we're hoping for within this community pathway. This pathway requires a partnership between community-based agencies to assess families, determine candidacy, and develop prevention plans and coordinate delivery of services, and as well monitor the prevention plan, including risk and safety. And Title IV agencies have the option to designate and contract with local service providers to engage with the family and coordinate receiving services and possibly other services funded by the block grant or other funding. So you can use this to engage families in 4E services or other services that could be funded by the block grant or other OCAP funding in some instances. Just as a reminder, the community pathway, the services are voluntary, and case management is done by the community-based organization who has contracted with the 4E agency to provide the Family First Prevention Services Program. This could be a school-based service, a behavioral health organization, a family resource center, or a tribal service provider. And how are families referred to the community pathway? It could be self-referral. They could be referred directly from a CBO or another association, such as a school or behavioral health organization. Or they also may be referred through the Child Welfare Services Agency when a referral doesn't meet the criteria for investigation. So just as a reminder, we have options for pathways within our plan. As part of the comprehensive prevention plan, there are 2 options of pathways for children and families to receive services. To be reimbursed specifically for 4E services that are evidence-based in the state prevention plan. And the first one is this Title 4E pathway. It's really our traditional pathway of voluntary court-ordered family maintenance cases or post-family reunification. Referrals in this traditional pathway will come straight from the child abuse hotline and offers Title 4E for services for children and family members. Oversight and case management is again done by the Child Welfare Agency in this case. And services may include non-4E eligible services, just as we do traditionally with child welfare. And it's hopefully the goal is to improve upon the traditional practices and success rates for these families using this 4E pathway. Now, the other option is what we just described before is a community pathway. And again, referrals can come from anywhere. This is not just our traditional Title 4E, Child Welfare Agency hotline. Services are voluntary, and engagement strategies such as motivational interviewing can be used to help develop rapport with our families and really engage families in the process. And the idea is hopefully to reduce the stigma with child welfare involvement. And the ultimate goal is, of course, to reduce disproportionality and disparities for families of color. So what are the components of the comprehensive prevention plan? What is actually required by the plan? Results of your pre-work and description of how your target population and services were chosen is really important in this process. We really have to engage collaborative partners across the board. Our multidisciplinary partners are essential to this work. Those with lived expertise are essential to this work. We must engage them from the beginning and include them as part of the planning and implementation process. So when you're thinking of starting, let's look first at our collaborative partners and engaging with our folks that have lived experience. And being sure to thread equity throughout the planning process by starting with engaging the community. And this step is key to gathering data from family experiences is essential to really developing your plan. It really helps us understand what are the needs, what are the services that need to be targeted, and how can we make the system better for everyone? Some of these components may be similar to the work that your agency or services sectors have already completed. It's really important to leverage those processes and information. Really, and that's one way to engage your external partners as well, your behavioral health, your Department of Education, your law enforcement, whoever will be at the table, public health. And really setting up a structure and a governance structure is also essential to this work, because that way it's a system and a process that's in place that can help you speed the process along and make sure that you're tapping into every planning and implementation need that there is. And again, needs assessment is also a critical component. So your agency may have already completed a needs assessment process. I've been asked this question in the past. What about our county self-assessment processes that we use in child welfare? Can we use that to leverage this work? Yes, use your processes that are already in place to leverage. If you already have an established team, such as an AB 2083 team and an MOU that's already established, a charter, use those systems and processes to really move forward with this work. We don't want you to have to reinvent the wheel, but these systems are in place to hopefully coordinate and lead to better access of care and services for all kids. This slide is really an overview of the planning and implementation process. This is a roadmap, and it really is to develop a comprehensive plan and implementation of services. Implementation means like putting the plan into action from the beginning to the end. So we're really thinking about what is the guidance and information, What is your process for capacity building? How are you ready to develop your plan? And what is the next step to really begin implementation? And as you can see, the capacity assessment falls within the capacity building phase. This capacity assessment you'll find in the ACL 22-23. And it's basically an opportunity to really look at motivation for change. And we'll go into that in a bit more detail in a few minutes. Another piece of the capacity phase is really looking at your asset mapping. What are your needs assessments? What is the data that's telling you? Get your partners together. Talk about the data points. And Paul Collier later today will kind of explain data and give us a good overview of how we can use data to really develop our comprehensive prevention plans. These phases are provided with flexibility for counties to start at their appropriate point of readiness. We know every county is at a different stage right now. We know some have done this planning work for a couple of years now, and others are just embarking on this planning work, and that's great. And so we're here to provide the support. And so the next slide, please, just to give you a sense of where we're at right now. So most of us are kind of in this stage, this pre-work stage that we're developing the plan. In this phase, the county is really identifying your partners. You're gathering the data again. You're targeting, you're determining what target population you're going to be serving so that we can really make decisions that will impact a good comprehensive prevention plan in the near future. This includes asset mapping, which is essentially a landscape scan of your current prevention. Okay, what is the purpose of our capacity assessment tool? As I mentioned, the capacity assessment tool is available through a link, and it's essentially just a survey that's within this link. And we encourage you to work with your partners to really fill out this capacity assessment. There's downloadable version as well that you can go through and then upload that information into the link. And that allows us to also see where your needs might be. Have you really established a group of folks that are ready for and motivated for change? That's our first thing. Are you ready for planning? Are your team members ready for planning? Do you have leadership support? Next is really looking at provider capacity and their capability. Do your providers have the support they need to build capacity? Do they have the capability? Do they have the funds? Do they have all the resources necessary to really build out a comprehensive prevention plan? Next is their systems capacity and the infrastructure. Do we have the infrastructure to really meet the needs of the population based on our assessments, based on what we know about our community needs? And do we have that motivation for change? And really, finally, it's that policy supports. What's next? What do you need to develop internally to really move the system forward? What are the policies and the infrastructure that needs to be put into place? And again, we're available to help with support in looking at your capacity assessments and helping you walk through this process. And it's available in the ACL that Kelly and I have mentioned, the ACL 22. So how does the team get started, or what prior work can my team leverage? So we heard yesterday from San Diego about startup activities for their team. They talked about partner engagement, transition planning, kickoff events, partner recruitment activities, work groups, and an advisor committee. Co-creation of a project vision is essential. Amy also talked about shared values and principles, roles, and responsibilities. Really getting a theory of change in place. What are your strategies? What are your activities and your priorities? Doing that logic model, knowing what your outcomes are going to be in the next 2 years, 3 years, 5 years. And doing that landscape scan. Increasing, the ultimate goal is what are we trying to achieve with comprehensive prevention? And we're trying to hopefully increase protective factors, increase family and child well-being, and hopefully decrease likelihood of child maltreatment and those adverse childhood experiences. That is our ultimate goal. And we hope that with early interventions and early prevention activities, we can reach that goal. And as this slide really walks through that process with you. So think about your cross-sector collaboration practices. Think about who those folks are going to be at your table that can help you move the needle forward. Complete that capacity assessment. And again, we're available for support to help you walk through that process. Establish a governance structure to help you kind of decide on what the steps are and make policy decisions. Engage your community. All folks, I know counties do this all the time. Engage your community as best as you can. They do it through the county self-assessment process. Utilize your partners to help engage the community for partners that you may not have on the table currently, but you know that are essential to this process. I remember working with Kern County as a prevention planning team, and we were talking about housing issues. We didn't have housing folks at the table, but engaging those stakeholders were essential to the process to think about strategies and plans for next steps. Asset mapping and gap analysis, of course, this is essential. We've been talking about it all the way through. What is the needs? What are your strengths? What are the things that still need to be completed to make sure that families and children have the needed supports and services so that they aren't experiencing adverse childhood experiences? An analysis of your prevention services and your population served. Who is that target population? What are the outcomes? How have they reached those outcomes? And of course, always review your cross-sector collaboration. Who needs to be at the table? What is that data? And Paul will share with us a little bit more soon. And again, we are here to support you through this process. You're not doing this alone. We will try and do our best. This is kind of a joint collaboration to really support you as you develop your comprehensive prevention plan. So this slide is really talking about leveraging of funding to create a comprehensive prevention plan. So we have, of course, we've talked a lot about Title IV FFPSA Part 1. That's our federal funds. And those are really towards our secondary and tertiary population. Those funds, again, as a reminder, they're reimbursement for those evidence-based practices. They're constrained in the sense that we can only use them towards our candidacy population. We can only use them for our tertiary and deep secondary population. And it's reimbursement. It is entitlement funds, but they are reimbursable. We have other funding sources available. We know that Title IV FFPSA Part 1 can't do it all for us. So how do we build out our systems? How do we sustain our system that we develop after we have a comprehensive prevention plan developed? One is, of course, you can go back to our Family First Transitional Act funding. There's funding available that can be used at any of the three target populations, our primary population, secondary population, or tertiary population. It's pretty flexible in its funding. Next, our whole State Family First Prevention Services Program block grant, our AB 153 funds. Again, we've made this opportunity flexible so that we know that counties need this opportunity to build out their comprehensive plans. So this funding is available for primary, secondary, and tertiary activities, including planning activities. We know some of our OCAP funding is more restricted in those ways, but this funding is available for planning activities as well as expanding on direct service delivery. The next is promoting safe and stable families. Again, this is federal funding. This is OCAP funding, Office of Child Abuse Prevention funding. Counties are given an allocation for promoting safe and stable families. And this can be used across the board as well, primary, secondary, and tertiary. This is an annual allocation. So folks, this is not necessarily funds that are going to go away anytime soon. Our Family First Transitional Act, yes. Our state block grant, as you know, is a term limited. Title IV FFPSA Part 1 might be entitlement. We don't know for how long. But our promoting safe and stable families, it's been here for a while, and we can anticipate that you can continue using it. Think about those funds for sustainability. We also have our American Rescue Plan Act, our ARPA, Community-Based Child Abuse Prevention Funding. And ARPA CBCAP funding is one-time funding, again. And the thing about ARPA CBCAP funding is essentially that it can only be used for primary and secondary services. It can be used, we've tried to make it as flexible as possible. There's no match with ARPA CBCAP funding. So it can also be used for planning activities. Folks, that most of our counties have, you had to submit a letter of intent to the Office of Child Abuse Prevention to receive this funding, and that funding should have gone out in April 2022. Please reach out to us if you haven't received that funding. But most counties did opt in for that funding. Again, this can be used in coordination with your Promoting Safe and Stable Families Act, your state block grants, FFTA funds, and of course, your Title IV reimbursement funds of FFPSA. Then we have our community-based child abuse prevention funds. These are also primary and secondary. Both ARPA CBCAP and CBCAP cannot be used towards our tertiary population. That's why we're talking about leveraging and blending funding. It can only be used for prevention at primary and secondary levels. Next slide, please. So, you know, a lot of folks have asked a question or kind of sometimes get confused about how FFPSA fits into the larger picture. So we've tried to describe that here. How does FFPSA really fit into the larger picture? We have the state block grant. And the state block grant is actually our large picture. It's our 153. It's flexible funding. It's for primary, secondary, and tertiary as our target population. Our Title IV eligible services, that's our FFPSA Part 1 reimbursed funding. That is only for our tertiary population. Again, that's for our candidate population. That's much more restrictive than our state block grant what we actually are starting to more closely refer to our state Family First Prevention Services Program block grant, which is established in 153. Next slide. And here we have offered you a lot of tangible resources to prepare you today. So we're going to have a little bit of a discussion of where do you think you are going to need help as a county? What are you interested in implementing? And what hasn't been provided? And things to think of over the next 2 days is, how will your planning team engage the community? How will you define the role of behavioral health and your planning teams, within your planning teams? How will your planning teams involve individuals with lived expertise? What pathways is your planning team interested in implementing? What type of support or technical assistance can we provide at the state? And some of these, your governance structure, your team building, all of that will really depend on what your services and what your next steps are. Really also going to depend on what your data shows. And Paul will get into that a little bit as we look into asset mapping and needs and strengths assessments. Next slide, please. Question and answers.
So we had a question in the chat about if the state was working to get PPP added. There are a lot of folks who have used this and invested a lot of time and money into this. And so I think there was just a question around that.
Yeah, I can try and answer that question. So one of the things that, Franny literally just talked about and we try to point out is for those programs who aren't currently in the prevention plan, you can still use state block grant funding to continue those programs moving forward. Now, having said that, we also have the opportunity to add programs to the prevention plan over time. The way that we approached our first round of our first version of the plan was to really focus on those well-supported activities so that we know that we can ensure the ability to continue to draw down 4E funds moving forward. We wanted to make sure that we were focused on stability and the ability to keep those Title IV dollars coming in to support the state funds. Having said that, moving forward, we do want to support, the PPP programs are definitely, in the clearinghouse, they're mostly rated as promising and supported. And there may be counties who want to put them into place so that we can continue to build evidence to get them up to that well-supported level. We may even have the ability to continue to support those programs over time. But the reimbursement rates for Title IV are different if you're talking about well-supported versus promising and supported. So right now, they're not a part of the prevention plan. You can use state block grant funds for them. We hope to see those evidence-based ratings improve over time. And we may be able to support from a state level perspective some additional evidence-based or evidence building in the future. And we can partner with counties to do that in upcoming iterations of the plan potentially. So that's something that we're thinking about and certainly appreciate hearing your feedback on what you're interested in partnering on those types of services.
Thank you so much, Kelly. I wanted to just highlight something that was typed in the chat by Richard Connect, where he says on the broadest scale and within a system of care lens, there are additional funding sources from other partners that can also support a local comprehensive prevention plan. I'm not sure if Richard wanted to comment more on that. Or not.
Actually, I can touch upon that because of that funding leveraging slide. As yes, absolutely. I know counties have talked about sustainability. How do you sustain these programs? And essentially, we have to work with our partners. We're here for the same end goal. We're serving the same population. And that's the whole point of system of care, right? We're serving those same kids We want to have the best outcomes and move towards well-being. And to do that, we have to look at our partners. They have funding available, they have resources. If we're serving the same populations, we want the same outcomes, we can look to our partners. This is the whole purpose of us really funding planning activities through the state block grant as well, is look to your partners. It's an opportunity to really engage everyone so that they also have outcomes that they have to reach and they have funding available. So if we can combine and leverage funding, what can we do? What can we possibly achieve if we really work together consistently and have a comprehensive plan that's really with the same outcomes and goals in mind? You can use those fundings for sustainability. I know that question comes a lot with our county, our current prevention planning teams.
Thank you, Franny. I think I've seen quite a few actually comments regarding like a cheat sheet that would help like assess like which funding could pay for what. I think just sort of like a little sort of like a cheat sheet, so to speak. Also, I just wanted to acknowledge a comment that someone was asking if there was a worksheet or formal document for the completion of the comprehensive prevention plan. So I'm not sure if someone wanted to comment on the resources that will be available for comprehensive prevention planning.
Yes, I think that's a very good question. So we are in the process of developing, really finalizing what we're calling our comprehensive prevention plan toolkit. And so a number of the items that are suggested in the chat will be included, including a funding guide, which will identify at least all of the funding sources available typically to child welfare services agencies. And I don't know if many of you may have noticed in the chat, Richard identified, he couldn't come off mute, but he identified quite a number of other funding sources that are available through our partners, like First Five, the Mental Health Services Act, CPA, and then local control dollars as well. So some of that will be available in the guide. There will also be a comprehensive prevention plan template for folks to use. Franny, do you want to comment on some of the other items available in the toolkit?
So there's a list of resources. Our partners here at Strategy STA really developed a comprehensive toolkit to help. So of course, as Kelly mentioned, that there is the comprehensive prevention plan template. And within that, you will find a host of different resources. We're looking at disproportionality and disparity. We're looking at asset mapping. We're looking at, of course, our readiness assessments, which we'll talk about further by Kush Cooper tomorrow. So it's really, as Kelly mentioned, we're trying to get out those tools as soon as possible. I did see that question come in. When is that? We're working as fast as we can. We've started the process for, we're just kind of clarifying, you know, what else is needed, and we'll have those posted on our website. But in Strategy STA, if you'd like to also share kind of what is in that comprehensive prevention plan toolkit.
Thanks so much. I just had a question. I missed on one of the earlier slides you had outlined a 4E pathway and then the community pathway, and I missed part of that. I just wanted to clarify my understanding, because what I thought I heard is that the 4E pathway, that the oversight and case management for that has to be done by child welfare services. And I just wanted to clarify, does that mean that to access that 4E funding, that it has to be through child welfare services providing that, or can 4E dollars be claimed if they're following that community pathway entry point?
So the eligibility for 4E services isn't limited to one pathway or the other. You can use and draw down 4E funding for either a community pathway or a Title 4E pathway. It's just really about how the services function and who does the case management. In the community pathway, we really designed that in such a way where we're trying to have as light a touch from the Title 4E agency as possible. It's really our effort to get as far upstream as possible and ensure that that families get the services that they need, or the child welfare is really the case manager of those services. So it's really about the separation of the systems. Now, Now, having said that, a lot of the services that are available in the community pathway are also 4E eligible. And really it's up to you and your county about how you design that. Some counties may choose to do only a Title 4E pathway and have their own staff do the case management services. Other counties may only choose to do a community pathway. Some may do some combination of both. It really is about what your local needs are and the services that you want to be able to either continue or increase capacity for. Lots of flexibility there.
All right. So I think there was some folks that were asking about the deadline for the comprehensive prevention plan and if there's any talk about possibly extending that date just due to what some people feel are very tight timelines.
So I think the thing we're trying to balance with the January deadline is the length of time that the state block grant is available. We want to be able to ensure that counties have time to expend those funds. And so that's where we struck the balance between later plans being accepted versus keeping to a tighter deadline. We're already well into the first year of the ability to spend those funds, and we hope that counties are starting to use those in developing the prevention plans. And now, having said that, January may come and we may have a different landscape on our hands and have to rethink, how this work is going. And so obviously things could change, but at this point, I think we're trying to get as much work done to get those plans in place so that we can take as much advantage of those funds as we can.